Hello everyone, my name is Mohammed Ismail. I'm one of the cardiology fellows at Mayo Clinic. Today I'll be talking about our project on the safety and efficacy of combining left atrial appendage occlusion with another cardiac procedure. So just quick background, as we know, left atrial appendage occlusion is typically performed as an isolated procedure. However, a lot of our patients who are referred for left atrial appendage occlusion have additional cardiovascular comorbidities such as severe aortic stenosis, congenital heart disease, and medication-resistant atrial fibrillation, which requires additional procedures over the course of their lifetime. And therefore, the idea of combining left atrial appendage occlusion with another procedure may allow for fewer hospital visits in addition to less exposure to the risks of anesthesia and vascular access, which may ultimately result in a net improvement in patient safety and, importantly, lower costs. And while combining procedures may represent an advancement in the field of left atrial appendage occlusion, they are currently performed off-label and data on their safety and efficacy remain very limited. And therefore, the goal of this study was to evaluate the safety and efficacy of combining left atrial appendage occlusion with other cardiac procedures versus performing left atrial appendage occlusion as an isolated procedure. So this was a retrospective cohort study using the National Inpatient Sample Database in the United States from 2016 to 2020 to identify hospitalizations for left atrial appendage occlusion and to compare the outcomes of combined left atrial appendage occlusion with another cardiac procedure versus isolated left atrial appendage occlusion. Our outcomes of interest included risk-adjusted MACE, which was defined as the composite of in-hospital mortality and stroke, and our secondary outcomes included in-hospital mortality in addition to several major complications listed here in the figure, and length of stay and total costs. We were able to identify around 89,000 patients who underwent left atrial appendage occlusion, of whom the vast majority had the procedure performed as an isolated procedure. After adjusting for demographic factors and clinical factors listed here at the bottom, we found that patients who underwent concomitant left atrial appendage occlusion with another cardiac procedure had pretty much similar outcomes compared to patients who underwent isolated left atrial appendage occlusion. The only exception was higher total costs in patients who underwent concomitant procedure compared to those who had the procedure performed as an isolated procedure. We found that the most common concomitant procedure in the combined group was atrial fibrillation ablation, and we found that the second most common procedure that was performed concomitantly with left atrial appendage occlusion was TAVR. And when we performed a subgroup analysis to evaluate or to compare the outcomes of concomitant ablation with isolated left atrial appendage occlusion, we found that patients who had concomitant ablation had higher rates of heart block, but otherwise most of the other outcomes were similar, in addition to higher costs in patients who underwent concomitant ablation. When we did the subgroup analysis comparing the outcomes of concomitant TAVR with those who underwent isolated left atrial appendage occlusion, we found that those who underwent concomitant TAVR had higher rates of stroke, higher rates of vascular injury, and higher total costs compared to those who underwent isolated left atrial appendage occlusion, and the other outcomes were pretty much similar. Now, as we can see, the total costs were higher in the combined group compared to the isolated left atrial appendage occlusion group, and this makes sense, and we can see this in the figure on the top right, where we compared the total costs in patients who underwent combined procedures in orange compared to those who underwent isolated left atrial appendage occlusion. We can see the costs are clearly higher in patients who had a combined procedure. However, the more important question here was, how do the costs compare in patients who underwent combined procedures to patients who underwent two separate procedures on two separate days, or sequential procedures, as this would have implications on cost and also on the healthcare system overall. And we did perform this analysis, and we found that patients who underwent combined procedures, here in orange, had significantly lower costs than those who underwent sequential procedures or had the procedures done essentially on two separate days. And this is extremely important, again, because it has cost implications for the patient and also for the healthcare system. So to conclude, in this retrospective observational study, we found that combining left atrial appendage occlusion with another cardiac procedure appeared to be associated with similar MACE and length of stay. However, certain complications were higher in patients who had combined procedures, and the total cost was higher also in the combined procedure group compared to isolated left atrial appendage occlusion. However, it's important to note that the cost of combined procedures was significantly lower than the cost of performing these two procedures on two separate days or sequentially. Thank you so much, and I look forward to your questions.